Hey everybody!
Hey everybody!
It's Wednesday Night Live!
Again! Oh my gosh, a whole week has flown by. What are we doing tonight, Ron?
Oh man, I'm so excited.
Are you?
Tonight I am interviewing Dr. Duncan. For those of you who don't know Dr. Duncan, he is the visionary behind Siskiyou Vital Medicine, which is a direct primary care naturopathic clinic here in Medford, Oregon, in beautiful Southern Oregon.
Yes.
Which is your vision. This is your vision here.
Yes.
And so we're going to get to learn a little bit more about Dr. Duncan tonight, about what inspired him to become a naturopathic physician, what inspired him to start Siskiyou Vital Medicine, and a little bit about his approach to his practice and what he believes in as far as health and wellness.
Wow, lots of pressure, man.
Dude.
Lots of pressure.
I know, these are tough. I should have given you these questions beforehand.
Yeah, right? Throw me some softball.
Okay, where did you go to school?
Yeah. So, also, before we get into me, let's talk a little bit about what we've been discussing lately, and that's SVMU, right?
Yeah.
Siskiyou Vital Medicine University.
Yes.
And what we mean by that is that we are developing a program, a foundational wellness program, where Ron will be teaching people about the current state of health, giving people the tools and empowering people to take care of themselves through some pretty basic things, right? So the basic things that we all need to be doing to ensure that we have the best opportunity to have the best health.
That's right. You know, if you look at the statistics, about 85% of our $2.7 trillion healthcare debacle that we're operating under right now, about 86% of that, all that money goes to dealing with conditions that are preventable. They are nutritional and lifestyle conditions. So, you know, that's where we should be focusing, and that's what I'm intending to do at SVMU, is to start giving our patients and the public the opportunity to come in and learn how to take care of themselves, and
Excellent.
And that's empowerment.
That inspires me. I'm so excited about that. That is so inspiring that we are going to be offering something like that to the general public and to our members especially.
Mm-hmm. I'm stoked.
Awesome. All right, so what do you got for me?
All right.
What do you want to know, guys?
Okay, Dr. Duncan.
If you guys have any questions out there about me at all, then you can go ahead and ask away, and I'll try to answer as clearly and as honestly as I can, depending on what the question is. All right.
Awesome.
All right, what's going on?
Well, I think, for me, I've been into this for a long time, and I've talked with a lot of people who become doctors or nutritionists or into health, and the question I always love to ask people is, what inspired you to choose naturopathic medicine?
Well, interestingly enough, I really didn't even know what naturopathic medicine was until about 2008. I actually, as a child, I always wanted to be a doctor. It was kind of the thing I wanted to do. But as I went through high school and started university, I thought it was a little unattainable. I just wasn't that interested in going to school a lot. I was more interested in exploration, exploring the world, doing things with my hands. I was in construction for a while, and so I sort of lost interest in medicine. And then I joined the Air Force and got back into the dental field and started working, side by side with a dentist and doing dental cleaning and hygienist work, and it sort of re-inspired me to get back into the sciences and the health field. Mm-hmm. Upon leaving the Air Force in 2007, I learned that my stepfather was diagnosed with colon cancer, and my stepdad was really cool. He's a really, really cool guy, and so I moved from Idaho, where I had left the Air Force. I was going to Boise State University at that time. Moved down to Houston, Texas, to be close to him. And through that experience, through his cancer experience, I really was disheartened by the conventional medical approach to cancer care and cancer treatment. Mm-hmm. And so it sort of really just pissed me off. It really lit a fire under me that I started looking for answers, and with the help of my wife Sandra, I found naturopathic medicine. And I, at the time, was actually in biochemistry in my undergrad, and we were learning about enzymes, and we were learning about all these things that are going on in this amazing body of ours. And I didn't feel like any of that was being addressed on the conventional side in terms of my dad's cancer care. And so I found naturopathic medicine, and it seemed to complement all of those biochemical pathways and all those enzymatic pathways that I was learning about in school. And so it piqued my interest. I visited the university, and I met really smart people, so that was encouraging. I didn't know
it's always a good sign.
I didn't know if naturopathic doctors were going to be a bunch of crystal wavers, or just something out there that I wasn't used to, more esoteric or more
woo-woo.
Yeah, so woo-woo medicine, right? I had no idea. And then you get online and read about naturopaths, and people call them quacks. But if you really look at what they're about, and in my opinion, naturopathic medicine is about using the best of both worlds. And so Bastyr University sort of met that requirement for me, where they were marrying the best of evidence-based medicine and traditional therapies that have been used for hundreds, if not thousands of years in treating illnesses, and looking at the body from a different perspective. And so I said, well, I'll give it a shot. If I don't like it, I'll go back and try dental school, because out of the Air Force, I was inspired to get into dentistry. So I completed my first year, and I continued on, and here I am a naturopathic physician.
That's awesome. That's awesome. And you went to Bastyr, right?
Yes.
You went to Bastyr University,
Yes.
which is one of the prominent naturopathic medical universities in the country.
Yes, absolutely. I think Bastyr is known for being more science-based. I think that's kind of what they were saying at the time. And what I found there was I think that's true, in that I can't speak for the other schools, but from my experience is that there was really heavily based in the sciences. We had all the ologies, right? Embryology, histology, biochemistry, anatomy, physiology, all of that. So it was really a really good experience. It challenged me, and through the naturopathic modalities and philosophy, I really found a part of myself that I really didn't know was there. Right? So this esoteric side, and I guess for me, a more common sense approach to medicine.
Yeah, I think a lot of people don't realize that naturopathic physicians basically go through the same training as a medical doctor.
Right.
But you actually have more tools to use when you're done,
Right.
because you get trained in alternative therapies like botanical medicine and homeopathy
and physical medicine and nutrition. So there are your doubters out there. So we have doubters regarding naturopathic medicine that talk about the lack of residency requirements for our profession, and there are residencies available for our field, but they're just so few, and they can't meet the demand of the graduating population, right? The graduating classes are too large, and the residencies are too few. So
and the paradigm still hasn't caught up yet either. So.
That's it. The paradigm hasn't caught up. But what I see and what I laugh about all the time is that the research is catching up to naturopathic medicine. We talked about healing the gut, healing the liver, detoxing the body, the importance of vitamins and minerals, and now we see research coming out talking about microbiome, talking about neuroendocrinology, talking about the lymph system, talking about how important vitamin D is. So, the science and the sensitivity of the science is really catching up to what we've known for so many years intuitively and through experience. So it's a validation in a sense.
Yeah, absolutely.
Yeah.
So when you were at Bastyr, was there a particular area of naturopathic medicine that intrigued you the most and that you've carried forward into the clinic?
So I would have to say that my biggest interest is in oncology or cancer care, and that was really inspired through my experience with my dad, and so that really intrigued me. But the other thing that really got me was that I was really good at dissection. So in the cadaver labs, when we're going through anatomy and doing dissection, I thought to myself, man, it would be great if naturopaths could be surgeons, because I really enjoy this and I was really precise. And I was good at what I did with my hands. So again, I got back to this thing with my hands, right? So, and then about my second year in med school, I injured my back. So I had a disc herniation, and that led to severe back pain and sciatica for about 2 years until I found injection therapies. So I continued through the course of my education and met a physician, Jeff Harris. He's in Seattle, but he practices prolotherapy. And I started visiting with him, and he was treating me for my disc herniation, and I found that it was really effective. And the only options before that offered to me were antidepressants and steroids and surgery. And I really wasn't interested in it. I thought, well, I'm going to medical school to be a naturopathic physician. Is there anything in the naturopathic realm or the regeneration medicine realm that could help me restore my function? And so the injection therapies helped me out tremendously. And so that really got me interested. So I started learning all I could about prolotherapy, neurotherapy, prolozone, PRP. And what I found was that I have a knack for that stuff. I through my experience, my own personal experience of having back pain and the disc herniation and then recovering through that, it gives me, or it has provided me with a different perspective, a way that I can relate to people that are experiencing pain. But it also gave me a tool in that I'm really good at using needles, right? And a lot of people freak out about that a little bit, but just like my dental experience, people were really scared when they came to the dental office, but I have a certain way with my hands and with my approach that I can put people at ease. The procedures that I do, I have people say to me all the time that, that was nothing like I had expected. It was way better. It really didn't hurt that bad. It's way different than any other experience that I've had, either whether it was in the dental office or another physician's office undergoing injection treatments. And so I just have a knack for that stuff. And so
you do. I mean, you stuck me the other day with a bunch of needles.
Yeah,
he does a great job. So
I appreciate that, and I think that's important. Because we're all looking for relief, right? Whether you're experiencing back pain, hip pain, elbow pain, to have chronic pain every day, it takes so much out of you. It takes a part of your brain, it takes a part of your attention,
part of your emotions.
Yeah, it's really emotional. So if in being able to do the injections I do, I get almost instant gratitude or instant feedback and instant results. And to me, that's fixing something. I like to fix things. I like to make things right with people. And so I really gravitate towards that. And then, the cancer piece, I just think that conventionally we have a piece of the puzzle. I don't think it's all the puzzle. And I think naturopathically we have the other piece of the puzzle. And so I'd like to blend those two together.
It's time for merging to happen, isn't there? To have the best of both worlds, freely accessed.
Freely accessed. And I was told today by somebody that President Trump, whether you love him or you hate him, he's talking about relaxing the FDA requirements for new medications and procedures, so that way people don't have to wait years and years and years to receive treatment. So what that would do is that would kind of open up the naturopathic profession or the naturopathic approach. The FDA no longer has to say yes or no to high dose vitamin C or ozone or poly-MDA or any of the things that we use to really support the immune system. But what I think is important about cancer care is that someone is looked at from a whole 360,
right?
Taking in the emotional component, the spiritual, the mental, the physical, the biochemical, and then also looking at cytotoxic medications and therapies like chemo and radiation and surgery, which I think have their time and place and their doses. So I'm really interested in discovering the genetic components to cancer care, the chemo component, the immune supportive components, and like I said, the mental, emotional, the realm, and really putting that all together. So if any of you out there know of an oncologist who wants to collaborate with me, please send them my information or have them call me, because I would love to do something like that. So that was a long answer to
that was great.
What inspired you?
That's great. It's great. So you graduate from Bastyr University.
Yes.
Right. So the next step, obviously, is to go into practice.
Yes.
And what was that like for you, like that moment, and what was your vision at that point?
Boy, that's a really good question. That was really like the bleep moment for me. Graduation. I remember going into my last quarter at med school thinking, all right, now what? What am I going to be doing? Am I going to do a residency, or am I going to go into practice for myself, or am I going to work for somebody? And ultimately, what I decided was that I want to work for myself. I want to have my own practice. I want to do the things that interest me. So I'm just going to bite the bullet and hang up a shingle and start my own practice. And so that's what I did. I convinced Sandra and the kids that Southern Oregon was the place. So we started visiting. We found that the Rogue Valley was a great community, and people kept saying to us that this is a great place to raise children. And so we made the leap, and luckily I had two other naturopaths that were willing to make the leap with me, and I convinced them to move to the Rogue Valley. Blake and Sarah Sue Myers, who are two wonderful practitioners. And we started Siskiyou Vital Medicine together. And initially we were a cash-based naturopathic clinic operating under a insurance model, which is, pay for disease care. So what I found was that by treating people the way I do, I was potentially putting myself out of business because they were getting well and they didn't need to come back, and the only way I would make a living was if they were ill. So there was a moment that that struck me that it was like, well, this really doesn't make sense. And I had given a talk at the Talent Library, and one person showed up to my talk. It was kind of humbling. So I had 15 chairs all in a circle, and I had the library to myself, and Sandra, she convinced one person to show up. She ran into one person that kind of knew me as an acquaintance, and we just had a heart-to-heart about business, and he was a business person. And he said, well, did you ever think about doing concierge medicine? Because I have a chiropractor in California who, he charges $80 a month, and I go in for adjustment whenever I want, and that's it. And that had brought back a memory that I had of my time in Seattle, where I listened to NPR, to this physician who was doing concierge medicine at the time, and how it had really freed him of the insurance model, where in the insurance model, docs are required to see patients every 15 minutes and to make a living because of the overhead so high. And there's so many things that we could go into and talk about. But that conversation I had in the Talent Library with that individual inspired me, and it solved the quandary that I had. The quandary of, okay, if I treat people that get better, then I don't make a living. Now I could treat people that got better, and I made a living on that, right? So it became a wellness culture and a wellness practice versus a disease practice.
Right. So you're doing something that's very out on the forefront of where a lot of clinicians or practitioners are going.
Yes. And
you're the actual first to do something as a naturopath, and that is to start a direct primary care practice.
I believe so.
Would you tell us about that?
Yeah, so I got super excited about the concept. Getting that answer of, like, what's my business model, where are my values, and having those things align. I just got super excited, and I called Blake and Sarah Sue, Doctors Myers. I called them. I said, you guys, we got to meet. I know it's Sunday, but we have to meet. We have to talk about this. So I'd convinced him about this crazy idea to start this membership model where people would pay us a monthly membership fee, and then we would just treat them and give them unrestricted access to our care. And it was kind of scary because, you know, if I have 4 people sign up, there's no way I can make a living, and we're living on, at the time, credit cards and borrowed money, and, you know, we were like getting down to scraping the barrel. I mean, literally, where we didn't know if we were going to even make rent the next month. So it was kind of like a Hail Mary, like, shoo, I'm putting this out there, and I really hope this works. So it was kind of an exciting time, but a very scary time. And so we had the help of a marketing team, and their last names happened to be Duncan at the time, and really fortunate that they came into our lives, and they got us on the radio here in Medford, and we talked about our model. And so I got off the radio that morning from the Bill Maher show, and got into the office about 9 o'clock, and all of a sudden the phone just started ringing off the hook, just ring, 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 and it would be like a week or two, and the phone would ring maybe like 4 or 5 times, you know, and I had maybe a handful of patients at the time. But as soon as people like heard about our model, our concept and naturopathic medicine, it just sort of erupted. And from one day to the next, you know, our practice started growing and growing and growing. So it just kind of took off, and I think it makes sense. And I think that the direct care model, where we focus on someone's health, really solves the modern medical issues of affordability and accessibility and transparency. So it's
real health.
Yeah, and it's easy. So, and people love it. Our members, they tell me every single day that they love our clinic. They love the model. They love how easy it is to talk with us, to access our care. So I'm really excited by it. I'm emboldened by it. I'm empowered by it, and I think it's the right thing to do. And now I'm teaching other naturopaths how to do this model, and I think it's wonderful.
Which is really exciting.
Yes.
You know, one of the beauties of this model is that it makes healthcare affordable for people. It
Absolutely.
makes real, legitimate healthcare affordable for people.
Yeah, you know, I always say that it makes healthcare affordable, but it makes naturopathic care affordable for people. Traditionally, naturopathic care has been reserved for the wealthy or the desperate. And naturopathic physicians often see people who have been everywhere, have done everything, have tried everything, and nothing's worked. You know, the medications no longer work. The surgeries haven't worked. And now there are no more options for them conventionally. And so they're looking for something else. And they end up in a naturopathic physician's office saying, look, I've done everything, please help me. So either they're really sick, or it's somebody that is really interested in optimizing their wellness. They're healthy, but they want to be better. They want to live well longer. And those are people that have disposable income and are able to pay the prices. And the prices are high because, again, naturopaths are working out of a business model that is based on the insurance model. And that's disease care, and that's time of service. So that means, you know, I'm charging $200 plus for the first office visit and $100 plus for returns. And insurance isn't going to cover that for most people, so that's really expensive and unsustainable. But with our model, which is $100 a month, you can come in as needed. That really just opens up naturopathic care to so many more people. You know, it's $1,200 for the entire year to experience Siskiyou Vital Medicine.
Yeah.
Right?
Unrestricted access.
Unrestricted access. It's incredible. So I think what it does is it gives people that access to naturopathic care, which is wellness-based, holistic approach, looking at the foundational issues, removing obstacles to cure, getting down to the root cause of illness, and then eliminating the chronic illness that's occurring in our population. And I think that's kind of what we're going for in terms of the SVMU, is looking at how can we establish a foundation that then leads to better health outcomes.
Right. And you and I are both involved with some things coming up for the clinic. And Exciting stuff. And the research that we're finding is that direct primary care practices on their own improve health outcomes.
Yes.
And then if you combine that with naturopathic medicine, it increases exponentially.
It's even better, right? So we're in a niche, and we're a niche within a niche, which is direct care and then naturopathic care. And I think that naturopaths are really fit or geared to bring about the best health outcome, because what we're looking at is how do you relate to your environment? How do you relate to the world? What are your stress levels like? What are you eating? How are you sleeping? How are you moving your body? What's going in? What's coming out?
It seems like all that has a major factor on your overall well-being.
Well, it's shown in the research. You can find, right? You can see that.
Yes.
That's research that shows that that's all really important. And there's also research showing that the better relationship you have with your primary care provider or your primary care team, the better your health outcomes are. That means less medications, you live longer, you have less chronic disease, you have less emergency visits.
Higher quality of life with longer quantity of life.
Yes, and that's what this is all about. That's what gets me going in the morning. And, I've always been a little bit of I've always had a little bit of a rebellious nature. If you tell me no, I'm going to find a way.
Why I like you so much.
Yeah, maybe that's it. That's what got me fired up to get into medicine in the first place, was a little bit rebellious against the convention. But to find naturopathic medicine and to really understand what it's about, it's not about replacing the medical doctor or the doctor of osteopathic medicine or the chiropractor or the acupuncture. It's not about that.
Right.
It's about utilizing all of what works best for that particular individual. So there's no one plan for everybody. Although nature does have its laws.
Yes.
Right? So there are laws, natural laws. This is a body that resides in a natural system that has to deal with gravity and air and water and energy. So there are things that there are constants for everybody, but I can't say that this is my protocol and this is for everybody for A through Z. It's really like, who are you?
Yeah. So you give the patient the gift of treating them as a unique individual and taking into consideration that they're operating on their own biochemical individuality.
Absolutely.
Yeah.
And we all perceive our environment differently. So my hot may not be your hot.
Right.
And that's just a basic example, but that goes, and I think you know this, but it goes layers. There's like so many layers of perception with each individual that when I say something to a group of people, each person will take that differently. Right. And that's the challenge, is like, who is the person sitting in front of me? Which
is the whole gift of this clinic, is that you get to take the time to get to know your patients.
Absolutely. That's one of the reasons I love this model. It gives me the time to get to know somebody, and I feel like our members are like family. We really develop a strong relationship. And some people we don't connect with, and those people, they move on. But hopefully, within the experiences, it was a positive experience. It's a growing experience for all of us. So. That to me is awesome. And and Sandra's asking about Ron's services included in the membership. Yes, of course Ron's included in the membership. He's the bedrock.
No, you're the bedrock.
Okay.
I'm an adjunct, but I'm like your wingman.
I think we're good wingmen.
Yeah,
and
absolutely.
I think we bring a lot to the table, and we have a lot to offer, and I'm really excited about what I'm doing.
Yeah. So that being said, segue to the next question. What Do you have, what are you most inspired by right now with your practice, and where the clinic is going?
Okay. Well, the clinic, I would like to bring the clinic, I'd like to develop the clinic further and offer more services. So the SVMU is really inspiring me. And this is I think this is a step towards being a resource for the community, in that we get to provide a lot of useful information that people can apply immediately to their lives that will make a difference, and that people don't have to pay for. It's something that people can just show up to and take the class. And I'm encouraging members to come in and take the foundational wellness classes. And I'm going to require that all new members take the class, because I think it'll save people a lot of time, but it will also give them insight into their own lives. And I think that that's what we all need sometimes, is a little bit of insight or a different perspective to change the way that we're seeing things, because I think that we have a tendency to get into habits and ruts.
Yeah.
Right? We kind of get stuck or mired down into our lives, and things start to narrow in for us. So if we have somebody to come in and just shed a little bit of light on things for us, it can really change our view. And I've experienced that with my own health, with my own situation in life, whether it be a social situation, financial situation, it sort of applies universally. And so I'm super excited about the education piece that we're bringing. I'm really excited about the aesthetics piece that we're bringing. Like I said, I'm really good with my hands. I'm really good with a needle. And we're offering some pretty advanced therapies here. So the PRP piece that we do for joints, for chronic inflammatory conditions, for aesthetics. And then I'm really excited about this other piece that I'm working on, and that is getting back to the land and getting back to the earth. And what I mean by that is I would like to develop a biodynamic medicinal herb garden where we can sort of develop our own remedies, but also have people come out and learn how to identify medicinal herbs, how to use them, how to prepare them, and how to grow them, so that way they can start their own medicinal herb garden in their home. So if they or their children or a family member has some health condition that can be helped by either lemon balm or mint or plantain or chamomile or numerous or a variety of herbs, then they can do that, and they don't have to go to the doctor and depend on somebody else to give them a medication or
empowerment.
Exactly. Like, why can we all not just be free?
Right.
And empowered and knowledgeable and inspired and
know how to care for ourselves.
Exactly. I mean, that's what I want for myself. Like, how do I take care of myself? How do I take care of my family? And how can I teach others to do the same? And then how can we all be a community together in that goal? Yeah. Or in that space. So I like to create community. And I think that's another piece of Siskiyou Vital Medicine that I really appreciate, is that it's a community center. And when people come in, and I appreciate you, Bob Gertz, thank you so much for your comments. When people come in, it's really like a community environment. It's really like family. So if any of you are looking for a new place to call home for a physician, you need another physician or a provider or an awesome nutritionist, lifestyle coach, why don't you just check us out and you come in and talk to us. We offer free 15-minute consults and
just to test the waters to see if there's resonance.
Exactly, resonance, and I love that. I love that word resonance, because I'm also into exploring how frequencies affect our health, whether they be an electromagnetic frequency or a frequency from a tuning fork that is set to the frequency of the earth, like the ohm. And we have Pat here who's doing that, so I'm really excited about that aspect. And being curious about things. So I really appreciate everybody's curiosity around health and the way we perceive health and how we perceive different things, modalities, healing modalities. So.
Let's check the time. I'm not sure.
Is it really? No,
It has to be.
Hour? Oh
Yeah,
my God,
wow.
we've gone over.
Woo, man. Okay.
Thank you, Ron. I really feel like it has blabbed through the whole thing. Just
Yes.
ran my mouth over the whole thing.
Do you have anything? Let's give you the last word. Is there anything that you would like to say to tie the bundle for people who are watching about yourself, about Siskiyou Vital Medicine, about your hopes and dreams for the clinic, and as well as for spreading naturopathic medicine around?
Well, yes, I would like to say that say thank you. Really, first of all, is I'm really thankful for the members that we do have, for the faith that they put in, the faith they have in us, the time that they put into this clinic. When people come in, I really do feel like it's their clinic. You know, I'm here in service. We're here in service to our members. We work for our members, so I really appreciate them. Without them, the model wouldn't work. Mm-hmm. Without our members, other people wouldn't have access to this. So it's a really, it's kind of a different concept, but it's really a community concept. Mm-hmm. So it's community supported medicine, and I really want to emphasize that to all of our members, that without them, none of this would work.
Right.
And so it takes a whole team to make this thing happen, and I think it's the right way to go. I think that this is the future of medicine.
Yeah.
And so my goal for Siskiyou is to continue to grow and expand and offer more and create more opportunity for members and physicians. I would love for small businesses to explore our memberships for their employees as employee benefits, because I think that we can really bring a lot to the table for them in terms of employee wellness or community wellness. I wanted to say community because I feel like, especially here in the Rogue Valley, we're all just a big family.
Yeah.
You know, I can talk to someone random on the street and they're going to know somebody that I know. And so if we can all just realize that we're in this together, and that the Siskiyou Vital Medicine is really about making a positive difference in our community in terms of health and human connection.
Yeah. Beautiful. Well said.
Thanks so much, everyone.
Thank you, Dr.
Thank
Duncan.
you, Ron. That was awesome.
No problem.
I appreciate you. I appreciate you guys. Thanks for watching.
Thanks, everybody. So,
So,
next week, same time, same place, Wednesday Night Live. We'll see you then. Thanks, everyone.
awesome. Bye, guys.
Bye-bye.
Cheers.